Thank you to all the speakers who joined us for the question and answer session, and to Josh Mailman for his skillful moderation. We're deeply grateful to each of the 22 speakers from across North America for sharing your time, expertise, and insights. Your contributions brought the theme, What Matters Most to Make Your Next Best Decision, to life in meaningful and practical ways. Dr. Hendifar, as we close, as you know, there has been many advances in the past decade, including this year. Could you speak to this and also how you see this field evolving?
Yeah, thank you. The field has changed dramatically over the last 10, 20 years. When I first started treating patients with neuroendocrine tumors, the best options were either surgery or somatostatin analog. And since then, we've had the approval of several targeted therapies. Several in this year, we've had the use of peptide receptor radiotherapy become mainstream. Ideas about liver-directed therapy blossom and be used more frequently. And then most recently, another targeted therapy for rare neuroendocrine diseases such as paragangliomas and pheochromocytomas. And I think now more than ever, getting a great team together and getting as much information is super helpful. And just don't always forget, just because we have fancy new medicines and treatments doesn't mean that surgery still doesn't have an important role. So again, broaden your treatment team as appropriate.
Yeah, thinking big and engaging the whole team. Mary, after living with neuroendocrine tumor for over 20 years, what do you now understand better?
There's such a wide range of treatment options, as we just mentioned, and it is complex and challenging to make these decisions of what to do next. So, what I've come to understand is to take the time and to do your research. And my suggestion is when you're living with stable disease and you have kind of more of a mental bandwidth, that's a really good time to do some of this homework. Listen to expert presentations, talk to your specialists, and talk to your net resources. Having these conversations about gathering information when you're not in crisis or under pressure or not feeling well can really make the decision-making process much less stressful in the future.
Yeah, managing your time and your resources. Dr. Hendifar, what would you like the audience to take away from today's conference regarding what matters most to make your next best decision?
Yeah, I think it's really important that the patients that are listening today really, think of the Neuroendocrine Cancer Foundation as a place where they can get a lot of the information they need to make their next best decision. And they do their best to engage the healthcare providers. But I think, this is a really great place and organization to get that information that you need to help educate yourself and your treatment team.
Yeah, it's a community and a team approach. Mary, what would you like the audience to take away from today's conference regarding what matters most to make your next best decision?
So I guess what I'd say is if you're like me, your next best decision is one that is considering both your quality of life and your quantity of life. And I'd say access to net experts who are invested in this as much as you are is key. And I'm so grateful that I have Dr. Hendifar on that team with me. For me, I want to feel like I'm in control of the disease as well. So I would say over the past 20 years, I've witnessed so many individuals profoundly shape the course of their cancer journey by having faith in their own instincts and combined with the shared wisdom of their net specialists. So I would say what matters most is you. No matter where you are in your journey, carry the strength and the resolve to make your best next decision and trust in your instincts, and you don't need to do it alone.
Hmm, you're not
It's really
alone.
good.
Wise words. Thank you, Drs. Hendifar, and thank you, Mary, for a rich discussion. Your perspectives added real depth to today's conference. And now I'm going to hand it over to Heather.
Again, a heartfelt thank you to our 19 net experts for contributing their invaluable time, expertise, and compassion. Be sure to take a look at the valuable information from our sponsor pages. Visit all 5 sponsor booths and receive a $5 Starbucks e-gift card. Go to our conference page at ncf.net/2025 conference. Again, today's annual patient educational conference has been recorded and can be viewed on our website and YouTube channel a few days after this broadcast. You may receive a survey via email after this broadcast. We would greatly appreciate you taking a few minutes to complete that survey. It helps us affirm what's important to you and opportunities in our educational content, format, and in fundraising efforts. We'd like to sincerely thank our technical director, Rich at TVP Live, for this exceptional production. And now I'll hand it over to Lisa.
Today has been about sharing knowledge, insight, and connection. Our hope is that you leave feeling more informed, empowered, and confident in making your next best decisions. Most of all, know that you are not alone. Our community stands with you, fighting for you and alongside you. We hope you can join us for our future educational events. Join us on July 10th for our Living with NET, the Patient Perspective webinar, where we will hear from 4 people living with neuroendocrine cancer. Join us for our August 26th webinar, Nutrition and Diet Considerations for NETs, with NET dietitian Megan Laszlo from Cedars-Sinai Medical Center in Los Angeles. Join us for our September 22nd webinar, Understanding Alpha and the Evolving PRRT Landscape, with medical oncologist Udaville Grewal. And save the date for November 9th, our NET Cancer Day Symposium in person in Miami. I also wanted to highlight a couple key resources we offer on our website. Our Clinical Trials Guide is an educational resource featuring several key clinical trials for neuroendocrine cancers. You can browse the site by the type of neuroendocrine cancer or types of treatments. And there you'll find patient-friendly videos and information about individual trials. We hope this guide will help you better understand clinical trials that might be available for you. NET Vitals is a valuable tool to help you prepare for medical appointments, assess your understanding about your disease, and communicate with experts or with each other. Check out our podcast featuring an interview with an expert on various topics, including types of treatments and types of neuroendocrine cancer. We also offer Spanish videos and programs. Go to our website for these and other programs and resources, ncf.net. Now I'm going to hand it over to Kavya.
Once again, a special thank you to our sponsors Novartis, Crinetics, Lantheus, Exelixis, and Curium. Our programs, such as this conference, wouldn't be possible without the support of donors like you. Become a part of our vision to empower neuroendocrine cancer patients and caregivers by donating at ncf.net. A heartfelt thank you to all of you for joining us virtually to learn more about what matters most in understanding and treating neuroendocrine cancer. And we hope to see you soon at a future event.